I'm anxious because the session starts on January 21st, and I can't wait to hear what Ige tells us in his State of the Address and tells us what he sees as priorities. But he's saying, at least during his campaign and when he first came out and got interviewed, he claimed that education was really, really big for him. And he wanted to empower all the schools at the local level to educate the kids. What is that going to look like? I don't know. You know, the other thing is he's a little concerned about the fiscal issue because he was the Senate Chair of Ways and Means. And what he understands is we are having a problem with unfunded liability, that we have so many people retiring and so many people that were government employees retired that are living to be in their 90s, some over 100. And we have obligations that we have to meet with them. And because that population is growing, that means we have to pay for their benefits, retirement as well as health care. And so this liability is growing, and we have to figure a way how to fund it. That cuts in to the programs and services we want at our local level. So he's trying to figure out how to meet these and at the same time to bring programs and services. So I think he's going to be conservative this year. That's my bet, is he's going to be real conservative because he sees there's some things that he has to get a handle on. Hawaii Health Systems Corporation met with Kona Community Hospital and Hilo Community Hospital over the last 2 days. They're going to the legislature. I think they're going to be asking for anywhere from $120 to $220 million. Why? Because the new contracts for the employees, they get pay raises and they get more benefits coming up. And that means we have to pay it. And they don't have the money. They claim they don't have the money. So each hospital in the last couple of years has been doing operational changes. They've been trying to find efficiencies. They've been trying to cut their cost of service, or cost of doing business, but they don't want to cut our health care programs and service and delivery. So what they're saying is, because you've increased the wages and the benefits for employees, you need to come up with the money, legislature, and help us out. So I think it's going to be a huge ask. With the unfunded liability, with this new help of Hawaii Health Systems Corporation, we know that we're going to start the legislature already with this big nut, right, that we got to face. So I think he's telling people that this year he's got to look at how to be fiscally prudent, how he can make things more efficient. Should we be adding more programs and services? That's going to be really hard to do right now. But you know what? Things change, and things change outside of us. And so we got to get better at what we do. And there's nothing wrong with new programs and services if you look at what you got to give up to get something new you have to give up. So how do we move the state forward?